I'm going to be talking about a pretty simple topic in terms of just vitamin B supplementation and its effects on depression and just preventing and also improving prognosis. For this particular article, it's a strictly review study where we performed a review of at least 30 to 40 studies performed across the world, including some in the US and in Asian countries. So just background, as everybody is aware, over 250 million individuals suffer from depression across the world, and it's becoming more and more frequent and more relevant in the most recent present, especially with the COVID pandemic, lockdowns, so many things have happened that the rates of depression have skyrocketed. And depression is no longer an adult or geriatric problem. It's a problem that exists in pediatric patients, kids as young as 9 to 12 years old, spans from kids to adults, adolescents, and everybody. WHO did categorize depression as one of the leading causes of disability in the entire world. This review basically focuses on vitamin B12 supplementation and if it has actually helped in improving prognosis, if it's combined with antidepressive treatments or even slowed down the progression of depression. So we reviewed a couple of articles, and I'm just going to go over the studies and what we were able to find. The main concept with vitamin B12, as everybody's aware in terms of biochemical reactions, is hyperhomocysteine, which essentially occurs because of the deficiency of vitamin B12. It prevents homocysteine getting converted into methionine and just creates this entire ripple effect where homocysteine keeps building up, causing hyperhomocysteine, which eventually affects the DNA repair, the DNA formation, as well as the red blood cell pathways. It also causes development of megaloblastic and pernicious anemia, ultimately affecting the cognitive function and mood of the patient. Along this B12 pathway, I know there's a lot of other B vitamins which are definitely playing a big role in just depressive symptoms and melancholic symptoms in major depression. However, we're focusing on B12, and it seems like it's definitely involved in terms of the serotonin system, the glutamatergic system, adrenergic system. So the levels of B12 definitely affect all these different systems in the body, ultimately causing depression and anxiety and other psychiatric disorders. With the serotonin system, vitamin B12 levels affect mood, appetite, sleep, aggression, again, resulting in depression, memory loss, short-term memories, again, with B12 can cause anxiety and depression, emotions, and just transmitter, learning, memory, motor function. All these things combined lead to depressive symptoms across the board. Hi, can everybody hear me? I think I lost my internet for a second.
Yes, hello? Yes, we can hear you now, and we can see your screen as well. Yeah,
great.
Please continue.
Okay. Among the studies that were reviewed, there's the top 6 studies, which essentially gave a positive feedback in terms of the correlation between vitamin B12 supplementation and its effect on depressive symptoms. The first one was performed in 2010 to determine if vitamin B12 or B6 intake affected depressive symptoms. And it turned out that higher intakes of both these vitamins reduced depressive symptoms over time. Another study also said the same thing, that long-term supplementation improved cognitive functioning, memory, just reduction in these neurological symptoms that are caused by vitamin B12 deficiency. Another study also stated that people that had higher vitamin B12 and folate levels had lesser depressive symptoms as compared to other people who had similar symptoms. A study also compared the effect of vitamin B12 in supplementation with serotonin reuptake inhibitors in terms of antidepressive treatment. And it was determined that the depressive symptoms were responding really well to the antidepressant therapy when vitamin B12 was supplemented with during this treatment. Another study was also done in women who are in antenatal period in terms of vitamin B12 levels, because of course, development is definitely important. And again, post and postpartum depression can be prevented with the supplementation of vitamin B12. One of the studies was very important during this review study, and it identified that individuals that have normal levels of vitamin B12, even though they're low normal levels of vitamin B12, also exhibited neuropsychiatric symptoms. It didn't really matter if their vitamin B12 was 300 or in the borderline or they're deficient. They all exhibited similar symptoms in terms of depressive symptoms as well as other neuropsychiatric symptoms. The main limitation for my review was that there were so many studies. However, there's not a really strong correlation. And also, while we're studying one vitamin B as opposed to the whole B complex vitamins, is definitely creates a big limitation in terms of understanding how it entirely affects depressive symptoms and other psychiatric symptoms. So that's definitely one limitation that I had during my study. However, talking from personal experiences, patient experiences, as well as the studies in pregnant women, geriatric patients, and adults across the world, it does seem like there is a little bit of correlation in terms of vitamin B12 supplementation. And over time, it definitely is showing to help reduce the severity of depression as well as improve the prognosis, especially when utilized in conjunction with antidepressive treatments. The main conclusion and recommendation here was to urge primary care physicians to identify patients with lower normal levels of vitamin B12 and try to address that early on in life as opposed to later in order to prevent the onset of depression. It's one of those things as primary care physicians take care of. And again, routine checkups are a great way of doing so. So I would just like to urge, along with this presentation and the article, to